In a world overrun with the fake, delusional, and disingenuous, he stands as a beacon of truth. He is Abuki Cabal. You are listening to Abuki Cabal.
What's going on, everybody? It's your boy, Abuki Cabal, but my friends call me Rodney. Thank you guys for hanging out with me, expressing interest in factual information regarding the COVID-19 dilemma that we're all enduring to the best of our ability. As you know, my duty, my mission is to expose as many people as I can in my community with factual information, reputable sources regarding the SARS-CoV-2 virus. Tonight we're going to be talking about the vaccines, and we're going to talk about the efficacy of these vaccines, how well they work. This data changes or has changed here recently. I'll address that as well. Got a little section here that talks about, well, we're just going to say that there are a number of people out here who will debate the use for vaccines, whether they have ever worked or whether they do work. I know this is hard to believe in a modern world where we carry cell phones and most people have access to books. But yes, these are the questions that we're being asked, or not questions, they're statements that are being presented in an attempt to convince other people not to take medicines that have literally conquered various diseases throughout the world, saved children, kept children from being disabled and walking in leg braces and whatnot, as we saw with polio and other debilitating illnesses caused by various viruses throughout the world. 14 diseases we've controlled thanks to vaccines: polio, tetanus, measles, influenza, hepatitis B, A, rubella, Hib, whooping cough, pneumococcal disease, rotavirus, mumps, chickenpox, diphtheria. Let's add COVID-19 to the list. So when people ask you what diseases have vaccines cured, there's a list for you. I've had to use this list myself in trying to convince other people who pretty much cannot be convinced. No matter what you put in front of them, they refuse to acknowledge these facts, which is unfortunate. So remember, risk reduction is addictive. Adding mask or other mitigating measures I mentioned to fully vaccination will increase your protection individually and will help us all. Less cases, lower prevalence, many lives and livelihoods saved. That is the goal of the people working hard every day to try to stop, the ever increasing flow of people into our emergency rooms and intensive care units. Dr. Angela Ramusin talks about an article that shows that 2 doses of the Pfizer vaccine is 94% effective against Alpha and 88% against Delta. This is old, but I'm going to read it anyway. AstraZeneca is 75% effective against Alpha and 67% against Delta. Any vaccine that is 88% against Alpha and 80% against Delta. These are not huge reductions, but that's all changed because the new data has indicated that the 2 shots are of the Pfizer will bring you up to 99% protection against the original and against Delta, is my understanding. So, I could be mistaken. Look up the data. I'm sure I'm not, but I'll leave it open. So, we're going to talk about the vaccines a little bit. The most common, question that I get over and over, is, how many people have died, from the vaccine, and, why is nobody talking about this? Why are they not collecting data on the people that are dead? So I'm going to talk about how that takes place. So, any report of death after a COVID vaccination is reported to a information collecting system that was set up with the CDC, and it's called a VAERS system, VAERS. And the reports of death after COVID-19 vaccinations are rare. More than 310 million doses of the COVID-19 vaccines were administered in the United States from December 14th, 2020 through June 14th, 2021. During this time, the VAERS system received 5,343 reports of death. That is 0.0017% among people who received the COVID-19 vaccine. Okay, now let's talk about that. So when that happens, basically a report is made, and then that report has to be investigated. So you have to make a determination as to whether the cause of death was caused by the vaccine. And a lot of these cases have been proven to be negative. That 5,000 number was reduced to a smaller number. If I'm not mistaken, I think it's 2,000 of the cases that could potentially be some sort of reaction associated with getting a vaccine or getting the vaccine or one of the vaccines. So what you normally look for when you have an adverse reaction, it could be any number of things, but what you're looking for is a histamine response. You may have some swelling, you may have some hives, redness of the face, swelling of the airway, difficulty breathing, things like this. But an adverse reaction can happen with anything that is introduced into your system that is foreign to your system. So I say could happen. Now, the likelihood of it happening is small. It does happen, but it happens with anything. It happens with anything from you taking pills to you taking injections to you taking vaccines. So this is these are things that we have to look for anytime we give you something, and we have to watch you. I have to watch you for a certain amount of time to make sure that you don't have an adverse reaction. When I received my vaccination, and I was among the first people in my state to receive it, I had to sit there for 30 minutes, and they had to watch me to make sure that I was not having any adverse reactions. Now, what reaction did I have? I did have some. I had headaches. I think for about, I think it was about 3 days. I had some issues with the first one. Some people say they have it with the second one. So I had headaches. I had some stomach problems, and I did have some body aches. So after that period, I went back. I didn't have any kind of elevated temperature or any difficulty breathing or anything like that. I medicated myself with Tylenol for the body aches, which is what you're going to do if you have a cold, the flu. Anytime you have body aches, you treat yourself symptomatically. Then you're going to treat yourself in that way. Pretty much over the counters, drink fluids, get plenty of rest, and pretty much you're back up and back to work. Now, I have seen people who have had swollen lymph nodes, who have had painful injection site, things like that. But the individual that I saw that had, some of the, the swollen area just below the injection site at the, below the armpits, it almost looked like it was a swollen lymph nodes. He had COVID before. So also a veteran. But we both talked about each other's symptoms. Both of us are in the medical field, and we talked about it. Was it something that was so significant that we wouldn't do it? No. So I had, less of a situation than he had. But even having that small reaction, he said it was far better than going through what he did with COVID. And his blood oxygenation levels dropped down very low. He was at work with me and got off work, went home, and he's actually my supervisor. So got home, tried to get up and go to the bathroom and could not make it to the bathroom. So he immediately grabbed his pulse ox and started to test himself. And he had no other symptoms, was lightheaded, just felt like he just was weak and could not, just couldn't make it to the bathroom, so he made it to the bathroom with some help, and tested his oxygenation levels, and he was very low, low 80s is what I recall. I think we talked, and he eventually ended up he was treated at the VA. So that's one person that I knew that had a rough time with that, and he was down for a couple of weeks. He was off. So I think he got the monoclonal antibodies, and I think he also they treated him with Pepsid and a few other things, and watched him to make sure that his blood oxygenation levels got back up to par. So that was, that's some of the things that you look for as far as those reactions. But yeah, that's just a little bit of an overview about what you see and what you end up or what you may encounter if you take the vaccine. Now, you have a lot of people don't have any indication that they had it at all. So I also had another nurse who had it, and all she had was some pain at the injection site, and that was about it. Muscle pain, and the actual area where her skin was penetrated. So it varies from person to person, but I've yet to hear of anybody who had that bad of a reaction. So I guess we'll move on to another another section here. Let me see what I want to go through first. Okay. Maybe I'll do this one first.
You are listening to Abuki Cabal, the analytical savage.
Okay. I'm going to go through this article here on Medical News Today. And title is COVID-19 vaccinations work with or without side effects. Okay, because some people were asking, well, if I don't have any side effects, am I protected? Am I okay? So this article was written to address some of those questions. So here we have, while many assume that side effects from COVID-19 vaccine mean that the shot is working, research at Johns Hopkins in Baltimore State that people should not interpret the symptoms that way. The research found that whether one experienced side effects or not, the vaccines worked exceedingly well at generating a strong immune response. Overall, 99.9% of the study participants successfully developed antibodies for fighting SARS-CoV-2 infections. Many people assume that when a person experiences side effects after COVID-19 vaccination, it is a sign that the vaccine is working. This may leave people with such symptoms wondering whether their vaccinations have been successful. According to new research letter from scientists at Johns Hopkins Medicine, this is not a valid concern. The Johns Hopkins research confirmed that Pfizer BioNTech and Moderna vaccines are exceedingly effective at generating a strong antibody response regardless of whether a person develops side effects or not. Okay. So here we have the letters. Senior author Dr. Aaron Milestone, associate hospital epidemiologist at Johns Hopkins, explains it wasn't known if it wasn't known if a lack of symptoms following vaccination or prior SARS-CoV-2 infection would indicate a less than adequate antibody response in people who received either the Pfizer BioNTech or Moderna vaccines. So we studied an available group of staff from our hospital to see if there were any connections. There were none. In the study, 99.9% of all participants successfully developed the antibodies the vaccines are designated to promote, or designed to promote, sorry. Okay, how the mRNA vaccines work. The surface of the SARS-CoV-2 virus is covered in spikes that latch to the healthy cells, allowing the virus to interact and infect. Both of the vaccines tested, the Pfizer BioNTech and the Moderna vaccines, delivered to the body a set of instructions or messenger RNA to make the spike protein. In response, the body's immune system begins producing immunoglobulins, antibodies, as a defense against the spike protein. The IgG antibodies destroy and eliminate the spike protein from the body. Should the immune system encounter SARS-CoV-2, the spikes of the virus trigger the release of these antibodies, which neutralize the virus or limit the severity of the disease it causes. It is of note that none of the available COVID-19 vaccines contain any living or dead SARS-CoV-2. And that is significant. Okay, how common were side effects? In total, 954 healthcare workers at Johns Hopkins Medical took part in the research. All of them had received either the Pfizer or the Moderna vaccine, and some had previously had the SARS-CoV-2 infection. that indicated an infection. What indicated an infection was either having a positive SARS-CoV-2 PCR test within 14 days of the second vaccine dose, or having an elevated IgG antibody count before receiving the vaccine. So a lot of people, one very loud individual that I was on a panel with, talks about, well, how do you know that these people even have it? The PCR test wasn't designed for that. Yeah, of course it wasn't designed for it, because it wasn't around yet. So, sometimes we have tools available to us that can be used to identify the genetic material in viruses that allow us to identify what they are, or identify them in the body. So a PCR test is one of those tools that we use. So they know that you're infected. So again, this is another thing where people say, well, how do we know that these COVID deaths are people who actually had COVID? Well, I mean, there are certain things that have to happen in order for you to, be diagnosed, and the declaration of you dying from COVID to be made. They're going to diagnose you with COVID before they start to we may isolate you before we even know. And then once identified, we'll proceed, with the precautions that are set forth. These things are strange to a lot of people because, it's not second nature to you like it is to us. It's second nature for us to put people in isolation that require it. TB requires isolation, among other infectious respiratory diseases. But respiratory diseases can be very dangerous and can be effective at taking your life as well, if not treated. So I'll get into that a little bit more. I will use a physician's presentation to, go through the manner in which we move when it comes down to identifying a disease and its process, the disease process, what we call it, and that's the path which it will take in progressing through your system. And we have junctions, in that process where we can intervene and treat people and try to prevent certain things from happening to keep you from dying or getting worse. So let's move on here. All right. So, like I said, the researchers asked the participants to report their reactions to the first and second inoculations. They could report none, mild, including injection site pain, headache, and mild fatigue, or clinically significant symptoms such as fever, chills, and fatigue. Just 5% of the participants reported side effects after their first inoculation, although 43% said that they experienced side effects after the second one. People who took the Moderna vaccine were more likely to have clinically significant symptoms after either dose. And those who had previous SARS-CoV-2 infections were more likely to experience them after the first shot, but not the second. The vaccines did their job. Whether individuals experienced side effects or not, almost all of the 953 out of 954 developed IgG antibodies 14 days after the last vaccine dose. The lone exception was an individual taking immunosuppressant medication, which it makes sense. Some people had especially high IgG levels, which the researchers linked to a few possible factors. These include reporting clinically significant symptoms, being female, being under the age of 60 years old, having received the Moderna vaccine, and having had earlier SARS-CoV-2 exposure. Lead author, Dr. Amanda Deebs of Johns Hopkins Bloomberg School of Public Health in Baltimore, tells Hub, the new news center for Johns Hopkins, the findings suggest that either spike mRNA vaccine will work well against SARS-CoV-2, even if a person doesn't experience symptoms after vaccination or if they had a prior infection by the virus. This should help reduce anxieties that the vaccine will be less effective in either situation. And that's the end of the article. Okay. Here is the information about, this is on the Centers for Disease Control and Prevention's website, Vaccine Adverse Event Reporting System, which is the VAERS system, VAERS. Okay. This is easily accessible. You can look this up. Okay, VAERS is an early warning system used to monitor adverse events that happen after vaccination. VAERS is the frontline system of a comprehensive vaccine safety monitoring program in the United States. It is one of several systems the CDC and the U.S. Food and Drug Administration use to help ensure vaccines used in the United States, including the COVID-19 vaccines, are closely monitored for safety. VAERS gives vaccine safety experts valuable information so they can assess possible vaccine safety concerns, including the new COVID-19 vaccines. It is especially useful for detecting unusual and unexpected patterns of health problems, also called adverse events, that might indicate a possible safety problem with a vaccine. Now, you see, this system is used for all vaccines. So there's already a system in place to gather information and to protect the public from potential safety issues. Okay. So, this also squashes a lot of concerns about people saying that, this vaccine is just not, it's not safe. It's not going through the normal channels. That's it's not true. Not true. You have millions of people who have taken this vaccine, and here you see people who have taken the vaccine who have allowed themselves to take this vaccine and to engage in studies, who know what adverse reactions to look for, nurses, doctors, etc., ancillary staff. All these people took this to ensure that this thing is safe for our patients. Okay. And we were the first ones to take it. So let that sink in. How many of the people out here will be the first ones to take that vaccine if they didn't have any, faith in the system and how it works? And I know what people are going to say. They're going to say, well, there are people in Houston that walked out that said that basically, I'm not going to take this vaccine. Well, that's where you have to take into consideration people's political stance, which muddies their mental faculties, and they make a choice based off of being on a certain team. That's what this is. That's why you see so many people out here not wanting to take vaccines, any kind of vaccine. This is not just, SARS, or the COVID vaccines. It's a lot worse than that. I used to work in pediatrics, and it was the same thing. You had families coming in there that just basically didn't believe in anything. Any of the past historical data on, vaccinations causing, these more prevalent diseases in the past that used to, just kill children outright and maim and cause all kinds of disease. And all of that's gone now. I mean, you can go out into some of the cemeteries and look at how many children were being buried during a certain time frames. All you got to do is look up that time frame when it was prevalent, and then go out into a large cemetery in your city and go look and see how many kids are out there. And then you can see that after immunizations took place, those deaths stopped. It's It's easy for you to go out there and go do. If you just want to go spend the time to do the research on your own, it's there. It's there. It's in stone. So, guess we'll move on. Get off my soapbox. If a health problem is reported to the VAERS network, that doesn't mean that the vaccine caused the problem. It warns vaccine safety experts of potential problems that may need to need to assess, and it alerts them to take further action as needed. Hundreds of millions of people in the United States have received at least one dose of the COVID-19 vaccine. The majority of the reports to the VAERS after COVID-19 vaccination have been non-serious adverse events. CDC provides timely updates on selected adverse events reported after COVID-19 vaccination. So then we go on down here and it says how reports come into the VAERS network. Okay, VAERS collects reports of possible adverse events that happen after vaccinations. Anyone can submit a report to VAERS, and they will give you a number and a website for you to report your symptoms when you receive your vaccination. And they will give you instructions as to how to use it and what to report. If you have some serious situation, one, you are to, go and seek medical attention, and two, report those, your symptoms. Now, if you don't call and report those symptoms, once you go to an emergency room, they will report those symptoms. They will collect the data and they will report those symptoms. So either way, that data will be reported. Okay, so the VAERS collects possible adverse events that happen after vaccination. Anyone can submit, including patients, parents, or caregivers, healthcare providers, and vaccine manufacturers. Under the emergency use authorization, FDA requires healthcare professionals to report to VAERS certain adverse events. And there's a list of those. I've already gone through those. You hit the link and you can see what those are that occur after COVID-19 vaccinations. The CDC also encourages reporting of any medically important adverse event, even if it isn't clear if the vaccine caused the health problem. This helps public health officials monitor and follow up on possible safety problems. Learn more about selected adverse events reported to VAERS. And there's a link for that. Okay, how VAERS reports are reviewed. Vaccine safety experts review all reports of serious adverse events submitted to the VAERS system. A serious adverse event after vaccination is something that causes permanent disability, hospitalization, or an extended hospital stay. If vaccinated while in the hospital, life-threatening illness, birth defects, congenital anomalies, and death. When VAERS staff members follow up on a report, a serious adverse event, they ask for the patient's medical records related to the event to learn more about what happened. VAERS reports are available to the public, but to protect privacy and confidentiality, they do not include information that could be identifying or could identify the person. Okay. Like I said, an intensive investigation occurs if it is suspected that any of these things occurred with any vaccination. So that hopefully addresses some of the questions that some of these people, that I was on this panel about a weekend before last, and a lot of this came up. So hopefully this will be helpful to some of these people. But VAERS limitations. VAERS reports alone generally cannot be used to determine if a vaccine caused or contributed to an adverse event or an illness. Some reports may contain information that is incomplete, inaccurate, coincidental, or unverifiable, like anecdotal evidence. VAERS reports often lack contextual information, such as total vaccinations given or information on unvaccinated groups, for comparisons. Most reports to VAERS are voluntary, which means they may be subject to biases. Data from VAERS reports should always be interpreted with these limitations in mind. So, that being said, you have to have certain qualifications in order for you to look at that and be able to decipher that information and, in a fashion that'll be useful in trying to help people get down to what is actually being said by this information. So that's why people who are actually, it's open to the public. Yeah, you can read it, but there are reports that are given that will basically tell you whether what's significant and what is not significant about the data that's collected. So know when to say when is what I'm saying. I don't go to a bread maker and say, you know what, this bread ain't right, because I don't know how to make bread. So know when to say when. Okay. There's another, article about comparing, each one of the vaccines. I will add this because I'm not going to go through all of this, but you can compare the efficacy of each one of the vaccines. And I will add all three of these in the description. So, moving on to the second part of this, I'll give you a little bit more data here. This data shows the percentage of sequenced and genotyped Delta cases from February the 1st to July the 19th by vaccination status. Okay, so you got that. You've also got vaccines work. The rise of COVID-related hospitalizations is being driven by unvaccinated or not yet fully vaccinated people. Okay? Again, you got it by the state. The blue are fully vaccinated hospitalizations, which is minuscule, unremarkable. Okay? The black is unvaccinated people who are being hospitalized. And it's 90% across the board. Okay? So we talk about these breakthrough cases, which everybody's talking about, well, if I get the vaccine, it's not going to help me. It's not going to work. It's not going to keep me from going into the hospital. It's not going to keep me from getting sick. Well, the data doesn't support what you're saying. So I would suggest that you quit being reckless and putting people at risk by putting, saying on your panels and whatnot that people are still getting sick and they're still going into the hospitals and, all of that crap, because I'm just going to call BS on it. That's exactly what it is. It's BS because, no one else is even, none of this data is supporting what you're saying. None of it. Nowhere. Not in one state. All the states are here. They're all reported in. This is just stupid. I mean, it's really stupid. So you look at the other, the other graph over here. This is from Kaiser Family Foundation. Both of those graphs. So for every 100 COVID cases in the U.S., only about 2 are fully vaccinated. Okay, you got your black confirmed COVID cases. You got your blue breakthrough cases. So that puts it into a visual representation that shows you just how small that number is. Okay? So, I just don't know how better to address it, so that it puts it into a perspective that is easily digestible and in layman's terms. So, there it is. I appreciate you guys, sticking with me and listen to the content. Hopefully this wasn't too long, and you guys will be able to do some good with it. Again, like, share, and subscribe. I appreciate you guys hanging out with me, ladies. Thank you for checking out my content as well. Don't let me forget you guys. I will acknowledge you guys as well, because we need to get this information out to everybody. Protect these kids, men, women. Protect yourselves. Protect the community. Protect your families. And I'm out.
I feel like a motherless child, a long way from home.